Okay, so part of the biology strategies for face-to-face classes is to ensure the overall health and well-being. You know, once school resumes, a big part of the child's day is really spent in school, and therefore it is also where the child can either become healthy or become sick. Okay, so it is therefore the school is therefore a very important place to ensure child health. Okay, so the immune system of children, adolescents, or adults is strong when the overall health is good. And vaccines actually will work better also for healthier children. So again, we must not miss the very basic principles of school health, which is to encourage proper nutrition, increase your physical activity, decrease sedentary behavior, have up-to-date vaccinations, and monitoring of holistic development, physical, cognitive, language, social, fine, and gross motor skills of our young children. And last but not the least here is that school health here pertains not only the students, but also the teachers and the staff of the school. Okay, so this nutrition, physical activity, decreasing sedentary behavior, it's not just for children, it's also for us, it's for the teachers, the adults in the school. Let's see some examples, strategies in the past 2 years from the different countries. So yeah, so they had vaccination, face mask wearing, isolation quarantine, and temperature checks. So it's also possible that this may have changed by 2022 already. Okay, it depends on their current counts across these different countries. So if we reopen, is there going to be cases? Well, the answer is yes, there can be cases, definitely, because we've seen that children can transmit to each other, and we've seen that in schools. Okay, like in Italy, they had 9 clusters in schools. They were able to identify where the clusters were. It was mostly in the older ones, middle and high school, none really in preschool children. In Hong Kong, there were no school outbreaks as of last year, but I just don't know about this year. There may be outbreaks already in their schools. Yeah, so yes, definitely it can happen. That's why it's important to do surveillance, the cases, close contacts, and clusters. That's why we highlighted also how to detect and report cases, close contacts, and clusters in schools. Okay, biology, preventing transmission through the environment, hierarchy of controls through population protection through vaccinations, and to the overall health of the students and school community. Okay, so that's biology. Well, I just want to share what we experience in PSPHP working with Philippine factories, because unlike schools, Philippine factories had no choice. No, they cannot do work from home, so they had to continue. So we can learn a lot from their example. So I just want to share here that we had one factory where we identified a specific room as a hotspot. Like, okay, there are cases coming from this area, and we couldn't really understand why. Is it a certain person? Is it so we went through the various levels of the hierarchy of controls. And then the engineers, because it's a factory, they have engineers, they said, that's the only area where there is recirculated air. So they designed it in such a way that air is no longer recirculated. After that, the cases went down and it was no longer a hot spot. So that's one lesson on engineering controls and being able to identify the hotspots or the clusters within within one work, in this case, work setting. Okay, so that's for biology. Next is BITES, which is really surveillance, and we know that it should be timely, because even if you monitor but you don't report it in a timely manner, then it is not useful. Okay, so we did that modules 13, 14, 15. Again, 3 C's: cases, close contacts and clusters, active and passive surveillance methods. What is surveillance again? It is the systematic collection and analysis of data to facilitate the prevention and control of disease. Some might call it monitoring and evaluation. It all starts with your objectives. What are your objectives? It must be clear, and the data to be collected must be proportionate to the objectives. For example, you want to identify and isolate cases, close contacts, and clusters in a timely manner. And as we said from module 14, that these objectives must be written in more detail, no, in a smart manner. Surveillance, so timely, to implement effective control measures in a timely manner. It must be representative of the bigger picture, no? So looking at population, the school overall, not just per case, but we look at the school overall and the trends. So it must be sensitive enough to easily pick up those who are at risk for the disease, but also specific enough to exclude those without the disease. So again, we discussed passive surveillance and active surveillance. So passive surveillance is really waiting for self-reports, basically. Or maybe you can just review routinely collected health data. Whereas active surveillance tends to be led by authorities, and you immediately act on any reports, or even when there is no report or no known cases, you really proactively go and ask students and people and families about whether anyone is sick, or anyone feeling unwell, or you're vigilant. The good thing about children, now I'm speaking as a pediatrician, is that it's a bit easy really to spot when they are sick. They will not tell you, sometimes they will not tell you that, but you can see that the energy is very different. The face is they look dehydrated, or they just have very decreased energy and appetite. Yeah, so you look out those are signs that they may be feeling unwell. Even if it's just a very, very low grade fever, or something is painful, their energy level really decreases. Okay, so sample surveillance objective: identify and isolate cases within 2 hours. But first, you have to define what is a case. We discussed that in module 14. The probable, suspected, and confirmed cases. And how or where will you get that kind of data? From symptoms declaration, or temperature screening, monitoring of students' activity and appetite, or if anyone is coughing. And then, the data analysis and utilization, is it going to be online or paper-based? Who are the persons responsible for receiving that data, validating it, analyzing, and reporting? And what your protocols are for isolation, notification, referrals, and return to school. And then another sample surveillance objective, which is really identifying and quarantining close contacts within 48 hours. Again, you start with the definition, where you will collect the data, who's responsible for it, and what your protocols are. Okay, so here we place some examples. Well, for different settings, some bigger or workplace may have CCTVs, they may have QR codes, RFID monitoring. Yes, so I place here also, you should be properly trained for contact tracing. You can probably ask for help also from your local BHERTS, but there are also online courses for free on contact tracing if you really want to pursue it.